Well, according to CBS News, it's HIPAA with 2Ps compliant. It's not HIPAA with 1P compliant.
I know, which is further concerning.
Maybe they did that on purpose.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs and also Security First IT. Joining me as always, Donna Grindle of Carden. How's it going, Donna?
It's going well, David.
So the HIPAA boot camp turned out great.
Okay.
We had an awesome time.
Y'all know he's saying this. We're recording now. Hadn't done it yet.
They don't know that.
Anyway, we're not good at that. I know they do that. You ever gone in where they record a show in Hollywood or something, and they tell you, this is coming out on such and such a day. So remember, we're going to talk about this, and this.
Mm-hmm.
Yeah. Not good at that.
Nope. We are living in the future. Speaking of the future, where art thou going to be in the future?
Well, you see, now I'm all messed up on what dates things happen, but I think this comes out the day I'm actually at the Georgia Access Management Association meeting in Buckhead. Their full-day seminar they do, and I'm doing things about patient right to access. What? Then, of course, I'm getting excited because in April, I get to go to the Jaws Society annual conference.
Yeah.
And going to be in Newport Beach. So I'm right on the beach speaking at Jaws Society. So guess what the speech is, what the talk's going to be?
Dun, 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 dun.
And just as you thought it was safe to go back in the water, ransomware attack.
That ought to go over well.
Well, you got to do something. Make it interesting. That's my job. And in June, I'm going to be at North Georgia Medical Management Association chapter meeting in Dalton, Georgia, Northwest Georgia. And right now, everything else I've been scheduling is client-based, not promotional organization kind of based stuff.
So you might get the summer off.
Well, I could do a lot of things if I could work for free. I could have a lot of clients if I could live for free. And, if anybody wants to take me into their mansion and let me live there, I'll be happy to help everybody out.
I'll do it, but you have to go by Consuela.
Never mind. All right, and on we go.
And on we go. So we had something come out earlier last week, I believe it was, to kind of come across our desk. And it's called Uber HIPAA.
Yes.
Interesting. So when I first saw it, I was thinking, okay, here we go. It's going to be another, spin-off of, HIPAA Made Easy. But no, it's actually Uber doing HIPAA. It's like doing ride-sharing services for healthcare transportation, which I thought was a great idea.
Mm-hmm. And, it is. I personally am really excited to hear about it. And I know there's even some services. There's a service, Liberty something, and they're trying to build a network of rural ride-sharing services, which is where it really needs to be, even more so in the areas which are covered by Uber and Lyft and those kind of guys. But the big news right now is Uber getting into the deal. I can tell you I've read about those rural ones getting into the deal. And then they're like, well, it's just one of your neighbors coming to pick you up. So I don't even go down that path of HIPAA with that yet, but it seems like a good time to discuss it.
So I have to say, though, yesterday morning, as I'm having my cup of joe, the CBS This Morning thing was on, and it just popped up. It's like Uber Health, and I'm like, oh, cool. We're just about to record about this. And so they're going down the list, and they get to one point, and they talk about it being HIPAA compliant. I had to pause the TV to take a picture.
Yeah, we're going to put it on the it'll be the featured image of this blog
Well,
post.
So I had to pause it because they misspelled HIPAA.
It's the HIPAA.
It's the PP.
Yeah.
No PP in HIPAA.
There's no PP in HIPAA. So yes, I'm going to use that. When you send it to me, I'm like, oh, killing me. And then I love it that they put down below source Uber. And nowhere has Uber misspelled it. I made sure of that. They have not misspelled it anywhere, or at least if they did, they've already fixed it. But I couldn't find it anywhere. But so I think it's a great idea. I mean, it's really something that's needed, and I have family members that should be using it, even if they refuse to use it. They should be using it. We're going to continue those conversations. No, I'm not trying to put you in a home. I just don't want you to always drive yourself.
Well, a couple of the cool things they talked about was how the rides can be scheduled like way in advance. And
you can do it when you make your appointment.
Yeah, and the healthcare organization can actually do it, which was interesting.
Well, that's the whole concept of Uber Health.
Mm-hmm.
So let's explain a little bit about the concept is that the providers themselves are actually going to be the ones that schedule the appointments.
Or schedule.
Huh?
Or schedule.
They're going to be the ones that log into a dashboard and they say, I need you to pick up somebody. Here's the address and here's the time I want them to arrive here and all of those kind of things. And somehow the billing is going to go through them and they're going to charge the patients the net of it is that the providers are the ones that are initiating the transport. And that is absolutely wonderful to make sure that people show up for their appointments when they have trouble physically getting to there. It's not that they don't want to show like me and you and where we just like, I don't have time for that. It's not one of those cases. They really do want to make it. And there are many, many times where people have to cancel because they can't get a ride. And that's just not helpful along the way. And this it solves that problem. However, there's some issues because we're HIPAA people. And how are they going to be HIPAA compliant? Because every news story said how it was HIPAA compliant, which what we say. Everybody out there knows what we say. It can be used in a HIPAA compliant manner.
Yeah. What exactly makes this HIPAA compliant?
Yeah, there's more to it. And so, again, it's just like a lot of technical folks and software people. They focus on one piece of compliance is what I think is happening. On their website, in the official announcement, it says, Uber Health is a HIPAA-compliant transportation platform for healthcare organizations. The web-based dashboard allows hospitals and other healthcare professionals to request, manage, and pay for rides for others at scale, meaning whatever the fee is right now. And then they go and put in their big HIPAA compliance bullet. And we have been working hard to develop, implement, and customize numerous safeguards. And we also worked with Clearwater Compliance, a leading HIPAA compliance company, to conduct comprehensive risk and compliance assessments. We are thus pleased to sign business associate agreements with our healthcare partners.
Oh, yeah, that sounds good.
Yeah. So first of all, Clearwater Compliance, those are not one of the ones we complain about at all. And so I was glad to see, they're working with those guys. So, there's some assurances in place, but right away I thought, I've had them call us in before and, we say, but you need to worry about this over here. And they're like, nope, all we want you to tell us about is this right here. Mm-hmm. Scope is everything, right? We learned that previously. So I went digging around, because that's what we do. We research. And in one PDF, nowhere else did I find it. I found it in this one safety PDF, which we'll link to. And the owner of Clearwater, you could, I'm reading it. I don't know about you, David, when you read it, if you see the same thing I do. So you go ahead and you read it and then tell me what you see there.
In June 2017, we conducted a HIPAA risk analysis of the technical, physical, and administrative controls related to Uber Health's new dashboard and technology. Our team concluded that Uber Health has an unusually robust security environment involving numerous information security safeguards.
So the words are important. What did you notice about the specificity of the words?
They're only talking about the security rule.
Well, no, they're only talking about that they evaluated the security rule requirements of the dashboard and technology.
Yeah, not the other
Nothing else. Nothing else. Just the dashboard and technology. That's all they're worried about. And they make that clear when he says related to Uber Health's new dashboard and technology. It's very specifically worded.
Mm-hmm.
We did not look at their compliance program or how they will manage privacy. We looked at the security safeguards in place for the dashboard and technology.
Yeah, very, very focused.
I would have done the same thing to try to, I appreciate the business and we're going to come in and we're going to look at what you ask us to look at, but we're going to be clear that that's what we looked at.
Mm-hmm.
And, that's it. Could be wrong. Never know. But to me, it looks like that's what Clearwater's clearly saying. So
don't want to muddy the water at all.
Well, they're good guys and they have some great stuff and they work with a lot of the big players in the market. And, they're not like, somebody that you and I often get frustrated with. But, I respect their input and that's why I wanted to see what was there. And that's when we found the very clearly stated, and that's the only place other than everybody bragging about them coming in and telling them and how happy they are to sign the BAAs. I didn't think anybody was really happy ever having to sign one.
No.
The general manager of Uber Health, he was interviewed everywhere, and one of the articles was in The Verge, so we're going to link to that too. We built this service from the ground up in a fully HIPAA-compliant technology stack. It was architected from day one. Everything we built from a technology perspective was to fit within the constraints and best practices of HIPAA.
Still only talking technology.
Exactly. And we know there's more to it.
Mm-hmm.
Things like the business associate agreements, they don't know what kind of rabbit hole those alone can be. And do they truly understand, what that means when they sign them? And, one of the big things is Uber has no employees. Everybody's a subcontractor. So does that mean they have BAAs with their subcontractors? How are they handling that? How are they does the subcontractor have to have a HIPAA compliance program or do they?
Yeah. So all these drivers are going to be calling us.
I know. How is this going to work? Because it doesn't take any of that into account because it's just focused on technology.
Mm-hmm.
There's a whole lot more to it. And then, of course, don't forget, there was a little piece in the news last year about Uber exposing 57 million driver and rider accounts and then covering it up, paying somebody, don't tell anybody you broke into us.
Mm-hmm.
Really? Really? And keep that in mind when you read the disclosure that they hired a lobbyist to, according to the lobbyist, her lobbying work would focus on the Health Insurance Portability and Accountability Act and healthcare policy related to, quote, transportation, ride sharing, and innovation.
Mm-hmm.
So she will focus on compliance matters and how that works. So they're trying to make sure that they can bring some legislation into play that will kind of get them around things, I guess. Oh, well, we don't like that. Well, we're just going to get it changed. I think that's going to fly. That's going to be interesting to see as more of this starts to happen. But those aren't really my biggest problems. Let's look at how the thing works. Right? So the way it works is the provider signs up for stuff. So whether it's the health system or your doctor's office, I guess your dentist office for that matter, it doesn't matter. Physical therapy would be a great thing for them, oncology, whatever. And they schedule the ride, or even if you don't do it at your appointment, you call, you say, I can't get to my appointment. They take care of it right then. They make the request just like the rest of us do and book the ride. So that's good because they're using that HIPAA compliant dashboard. And that's perfect. And then that's all good. We're worried about the technology, and as long as they're doing the right thing and all of that, we're good there. The passenger, I love that. It's the passenger. It's not the patient. It's the passenger is contacted by text or a phone call with the details when their ride's booked, and then again when the driver's on the way. And they've made a point of making it clear that you don't have to have a smartphone to use this because the provider's taking care of it. Because God forbid, I have friends that are not technical people, and you would have thought that I had opened up their ability to fly when I taught them how to use Uber and Lyft. It was like a whole new world I can see. But, that is by itself, it's really awesome stuff. But if you don't have the skills or the technology to do it, so they've found a way around that. That's great. And then the driver picks up the passenger, and it falls in the driver's list, they say, just like any other passenger. So they're seeing it so that then that way, according to them, the driver doesn't know that they're a patient. They're just a passenger going from point A to point B. And then the charges are handled, on the provider end.
I'm seeing a waiver somewhere.
Yeah, I'm seeing a lot of problems with that last bit. Everything right up until the point the person gets in the car has been on all of this technology, platform, HIPAA compliant stuff. Once a person gets in the car, now everything's out of whack. There's no HIPAA decisions there because their theory, what they're saying is they don't know you're a patient. Therefore, you're just like any other rider, and they don't know how the arrangements were made. So that gets them outside the HIPAA realm. Mm-hmm. Yeah. I'm sorry, but you're still being contracted by the provider. And I don't know. Yeah.
Well, this to me, and you probably have the exact same concern. To me, what does this mean for the providers? Because that's where we're going to come into play.
Well, yeah, they're going to have to do a risk analysis because all over that dashboard, I checked the onboarding and all the doc, and they're like, well, you enter the stuff here and then you download it to a CSV, and you can get all of your billing information, and you put the patient information here and then download it to, in multiple places, download it to your CSV. Well, what does that say?
It means you're going to have PHI all over the place.
Yeah, well, we don't put PHI on our devices.
Okay, whatever.
Do you use Uber Health? Because you got to show me how you're redirecting it, Mm-hmm. And the problem is that, they're going to sign up these providers to do it, and then the providers, it'll be dumped on them when they don't properly secure it. So please, if you're going to do this, then you, as the provider, educate yourselves on what that requires and do a proper risk analysis of the implementation part. Like, what data am I going to now know and share that I didn't do before?
Yeah. And where is that going to be stored?
Yeah. How am I going to create, receive, maintain, and transmit it?
Yeah. So, so I don't have to hear anybody say, well, most stuff's in the cloud. I don't need. Oh my gosh.
Most stuff's in the cloud. And I don't ever put anything on our computers. Yeah.
If your data's in the cloud, where's your head?
Okay, so providers do a risk analysis, and nowhere in there is it really encouraging them to remember this will be new exchanges of data.
Mm-hmm.
Now, we don't often get offices who go, oh, yeah, I better do a risk analysis. Usually it's, really? I need to do one of those? It's a back side of it. And then, based on their history and what we know about BAs and their issues with reporting potential breaches of PHI, what are we going to do there? I mean, I got nothing. Seriously. Yeah. How's that going to happen? And then, this is where I'm really worried. This is where we talked about once they get in the car, privacy is going to be an issue somewhere down the road. The only question is going to be, how big of a deal will it be? But it'll be one.
Yeah.
Because it doesn't matter. It's the drivers. So even if you claim this driver doesn't know that I'm a patient, what do you think is going to happen? So first of all, if a driver ends up picking up the same person to take them from clearly what is their home to an oncology office multiple times because they have to go repeatedly when they're on chemo, and they end up taking them multiple times, do you think that driver's going to kind of figure out, wait a minute, you've got cancer and this is the doctor you see?
Mm-hmm.
Maybe, some of them are smart.
Yeah.
They are. It's people from all over the place and different backgrounds and different agendas, we'll say. And not to say that they're any different than any other driver, but where's the liability?
I don't know. That's a good question.
And when they share that information or misuse that information, they're going to try to say, well, the driver didn't know it was HIPAA. But how can the patient make that assumption?
Right. Yeah, because this is not the same as the patient calling for the Uber ride. This is the provider starting that relationship. Yeah. So it completely changes the dynamic of what's going on.
Mm-hmm. Mm. And then you take it a different step. And I don't know. We've had our own taxi rides together, our pedicabs, ride shares. And I'm sorry, but the drivers are going to chat with you.
Oh, yeah.
And you're going to chat back. And, I'm sorry. All it would take is one question from my mother, and they'll learn every ailment she's ever had. It's just the way they are, It's just the thing. So if you're going to say, how many times do they say, hey, where are you going today? Or how you feeling today? That's it.
Yeah.
And off they go. Now, is there going to be a way to argue there was a certain amount of presumed confidentiality because my doctor sent you to get me?
Yeah, that's what I said. I think they're going to end up having some kind of big waiver that tells the providers you'll have to have them sign this in order to use that service. And then they're going
to they don't have to be HIPAA compliant, I mean, it's a loop here that's not closed as far as I'm concerned.
Yeah, there's a lot of questions for sure.
And the privacy attorneys are already making progress
mm-hmm.
in being able to say who's liable. And if you just look at the Connecticut case where the Supreme Court in Connecticut has said you can assume that your doctor should be protecting your confidentiality, including with the HIPAA privacy and security requirements.
Mm-hmm.
It's just a matter of time before that gets referenced in other states. I mean, they said it's basically like a standard of care. Well, I don't know about you, but the first time a health system is left hanging and Uber says, well, it wasn't because of us, because, X, Y, and Z. And I don't know that they've thought this all the way through, is what I'm saying.
No. I mean, and they clearly have a culture of security.
Well, you got to hope that all of the turnover and all the changes that they've made with the company, that's what's happening. But there's, always that perception of I have to worry about what I know, not what you wish that I would know.
Right. Yeah.
So, and when you add that to, and I had originally thought about going through this report today, but when you add that to the Verizon report, the 2018 PHI data breach report, it's full of really interesting stuff, and we'll try to get to that in another episode. But one of the most important points that it makes repeatedly is that healthcare is the only industry that really has their number one problem being insider issues and misuse. Well, what we just discussed falls right into that trap. So if they are getting into an industry that already has this problem, and we know it, and then you're bringing in a scenario that's not clearly defined on how you would deal with that problem, I don't know. Maybe I could make an assumption it'll be a problem.
Shouldn't assume.
Oh, yeah. Well, we know what assume says. So how long do you think it'll take?
It won't take long. It won't take long at all. I'm just hoping that the providers aren't left holding, the bag, so to speak.
Yeah, that's what I worry about is that, there's no way most of these providers have the legal teams that Uber has. And we know they've had enough legal issues that they've got huge teams. And, it's clear that it's not the technology that we're worried about. Not at all. It's how you deal with the drivers and what the drivers know. And what they do with that becomes a bigger issue.
But the dashboard's good.
It's HIPAA compliant. I'm not worried about the dashboard and technology. Sounds like it got checked out really well.
Well, according to CBS News, it's HIPAA with 2P's compliant. It's not HIPAA with 1P compliant.
I know, which is further concerning.
maybe they did that on purpose.
If you misspell it, maybe we can kind of get into that loophole.
Yeah, we never said we were HIPAA 1P compliant.
Yeah. Are you 1P or 2P HIPAA compliant? All right. So that's my concern. And I don't know. Honestly, I have no idea how long it will take for something to happen. But I think you're right, is they're making this major show and announcement. And like I said, other ride shares have quietly been doing it. And you and I both know when they're talking about doing it in a rural community, and one of the quotes they have from somebody who's been taken to the doctor multiple times, it's just like having your neighbor pick you up.
The real question is, when they do have a problem, how much are they going to pay to cover it up?
Yes. It's what are they going to do? There's not a track record for us to feel comfortable about how that's going to happen. So, Uber, they were the ones breaking new ground with this concept in the first place. They really, there's a reason that it doesn't matter who you're calling. Everybody says you're calling the Uber.
Yeah, you're right. It's kind of like make a Xerox copy?
Yeah. Let me Xerox this. And, I think people have finally stopped saying that because Xerox had a fit about it. Do you have a Xerox? Yeah, it's right over there. Well, that's not a Xerox. It's another brand. But yeah, it's the same thing. It's like Google it. Well, even if you use some other search engine, you're still Googling it. They have become synonymous with ride sharing. So
you gotta love it when your business becomes a verb.
Really?
I know.
Oh, now we got to figure out what the verb cardon is. You need to cardon it.
Exactly.
Yeah, I'm open to ideas. We'll take them. I don't know if we'll tell them, but we'll take them. Bring them on.
I can tell you some verbs I would use.
Never mind. No more from you.
All righty. So this ought to be fun to watch.
That's good for today. We're going to watch it.
Yeah.
But this is why I knew it was too much for me to mix it in with something else. It was just going to be too much for us to pass up. Because, it's one of those where 6 months from now, we want to go back and say, hey, remember when we said such and such,
Yeah, we do that.
Yeah.
I was right.
I know, I was right. So, well, pretty soon we're going to do some cybersecurity law episode. We've got one episode full of listener questions where we've set them aside and just not been working them in, which clearly is a problem that we have, or as David will clearly state, it's my problem because it's my notes. But we're going to do a listener question episode, and we've got the list now, but if you send in some, clearly we'll try to do them more often. But thanks for listening, and we got some great feedback on our listener survey. Appreciate that. And one of the comments we had was, love the show notes and the bonus PDFs for the training certificates.
Yep.
So,
awesome.
There's an app for that. It's awesome.
And also, I mentioned it last week, but we've had the ability for people to give or donate monthly, because we've had people say, I want to support the show and help you out. You do so much for us and giving us free content. But we've had a few people says, I want to be able to give one time because, for whatever reason, I need to be able to donate one time and write it off versus monthly because my organization only lets us do it one off. So I fixed that. And I mentioned that on the last episode. But now if you go to helpmewithhipaa.com/give, you'll have the option of a one-time donation, or you can click on the button. It'll take you to our Patreon account where you can set up a monthly recurring donation. And they're not much. I think they start like $1 a month or something like that. So
yeah, we appreciate all of those who are supporting us.
Yeah, absolutely, we do. They help to pay for Donna's meds to put up with me. She believes in a better life through pharmaceuticals. So
that's part of the reason I finally agreed, is he agreed to pay for the meds.
Yep. So as she often tells people, it's still not enough to put up with me, but it takes the edge off.
Yeah, that's why you and your wife and I can have such great conversations.
I know. All right, folks, that's our show for today. Please remember to follow us and share us out on your favorite social media site. Rate us on our podcasting app. We need your help. Get the word out. We're growing by leaps and bounds, but it can always be better, and we appreciate it. So send in your questions and ideas. We will get to them at some point. You can do that at contact@helpmewithhipaa.com, and might even put you on the show. Who knows? At some point. We do answer them pretty quickly. We just don't necessarily put them on the show pretty quickly.
Yeah, sorry about that.
So anyway, for Donna and myself, remember, HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.